I want to say thank you guys for coming on. I was kind of reflecting on how all of this came about before we started, and I was just it's I don't know. Boston feels like it's a big city, obviously, but it also feels like a really small town sometimes. And like Hannah, you I think came to one of our networking events here at the office, and then Allison, you came and spoke at one of our roundtable events, and we've connected over Zoom a couple times, and I think we probably share a couple patients. So. I don't know. We've all just kind of been mingling around, similar spaces, even though we're coming at it from different places. Like us is more of the sort of sports medicine side, and you guys is the mental health side. But I think there's a lot of overlap there, which is why we thought that it would be fun to just kind of record a conversation, and I think there's value in that. So yeah, again, thanks for coming on and. I talk about you guys a lot with patients, but I'd love to hear from one of you. I'm sure you all love talking about yourself, but can you just talk a little bit about ES therapy, your group, and where you're at, and what type of people you tend to work with?
Absolutely. Yeah. Our practice was kind of birthed from an idea. Hannah and I worked together at the Brookline Center, and one day we were having a COVID safe walk around the reservoir
Mhm.
back in 2020. And we just started musing a little bit of like, what would it be like to provide mental health support for athletes in particular. And we realized in that conversation that both of us got injured on a training trip our freshman year of college, and that those injuries ended our careers, and there were a lot of mental health
Wow.
implications that came from that. And we kind of imagined, we wanted to imagine what would it be like if we had had ES, right, at that time
Hmm.
in our life. And so, kind of whatever, fast forward, and now here we are, and we provide, mental health services specifically for athletes of all ages at all stages in their careers and post careers, focusing a lot on identity development, right? Who
Hmm.
am I? As an athlete, who am I post athletics? How do we incorporate sense of self with the athlete? And of course, the mental health implications that come from being a highly competitive athlete, injury, perhaps developed eating disorders or substance use in order to kind of cope with those, competitive lifestyles and that kind of thing. So,
Yeah,
yeah.
I would say we really like I think our one of our first conversations was one about how there was nothing there for us when we were on these
Mm.
trips. And funnily enough, I think both in Hawaii and Allison was a swimmer and I was a diver. So there were just like weird
Mm.
overlaps when we were talking about this. And they didn't even have a physical like a PT with us on this
Wow.
trip. So there was no support at all.
Mm.
So kind of talking about that area domain of things, and then also talking about like how much sport was helping us cope with things we didn't even know we were coping with. And so then
Hmm.
when we weren't doing that anymore, it wasn't even just like, oh, I don't know who I am necessarily. It was like, I don't know who I am, and I didn't even know that this thing was helping me manage like all
Wow.
of this.
Other
Um,
issue. Yeah.
and so for me, that led to an eating disorder for Allison, other kind of things. But it was like, oh, I need a home for all of this now because my sport was all encompassing. And now I'm like untethered. I don't know what to do
Hmm.
with it. And so
Right.
we
Wow.
realized there's so much more to this than it felt like the average, therapist or mental skills. Like it just didn't feel like there was anyone saying, like, we see all of this going on and we
Hmm.
wanted to provide that service.
Yeah. And so therefore, all of our employees and the folks that we partner with were former athletes or, or I mean, were former athletes now, are
Mm.
Yeah.
athletes at different
Yeah.
stages in our lives, right? So, we really are passionate about providing support, for athletes from athletes. So, because as Hannah said, there's something very specific about this journey. Oftentimes, I work with a fair amount of college kids, and so they'll have tried to go to campus counseling or whatever, and
Hmm.
oftentimes they get feedback from their therapist of like, oh, it's just a game, or oh, your major
Mm.
stress is your sport, then quit, right? And it's like, that's not really how this goes, right?
Yeah.
And so unless you've kind of been there, like it's hard to see that, and so as practitioners, we take that part of our journey very seriously. And
And there's something kind of inherently toxic about highly competitive sports. Like, in order to
Mm,
reach that level, you have to shut things down that the average
right.
person in a session you might talk about maybe not shutting down. So, being able to hold that dichotomy of like, this got you super far. Is it still serving you? How do we hold all of that at the same time as a lot of our conversations with people?
Absolutely. Like
Oh,
perfectionism is a big one, right? And it's like, okay, well, it's a double-edged sword because perfectionism has allowed you to be this successful in your life and also,
hmm.
right, has caused all of
Yeah.
these problems. So it is hard, it's hard to kind of hold those pieces of like, how do we navigate this? Yeah, and I think that's pretty specific.
Yeah, I mean, I love that. And it can relate to so much of it personally as a previous current athlete and professionally. I feel like you really do have to know and understand that the mindset of the athlete to be able to work with them successfully. And it makes me think we appreciate and respect the work that you guys do because you work with athletes and that's the population that we work with mostly too. Um, and as a group like our group, we predominantly people come to see us because they're dealing with some physical pain, like a musculoskeletal pain, or a sporting related injury. But inevitably, there are also people that are dealing with persistent pain or sport type injuries are also experiencing high levels of stress or higher than average levels of stress, anxiety, maybe depression. So and that's not something that we necessarily will deal with directly. It's why we need, have always wanted to, bolster our network with lots of mental health providers and people that we could refer to handle that side of things. And I think the deeper that you get into working with humans in any way, shape, or form, whether it's from the physical side or the mental health side, you learn to appreciate all the aspects that make this person in front of me feel whole. um, so we've just noticed more and more over the years the relationship between mental health and physical recovery rates, even. Um, Sorry if that popped up. It's a telemarketer. So I guess I'm wondering if people come to us and they're coming from the physical pain injury perspective, and we're noticing that, oh, this person is also dealing with high levels of anxiety and stress, and we should get them in front of someone that can help them with that side. Do you guys notice it in the reverse also, where people will come to you with reporting, difficulty dealing with stress and anxiety or depression and but also having physical manifestations from that? Do you know what I mean?
Oh, 1,000%. Um, I would say that a lot of my so I specialize in eating disorders, and so like I'm always kind of ping-ponging between the physical and the mental side of things.
Yeah.
Um, I think the way that I see it show up the most is probably within people's GI systems, but
Mm,
definitely like musculoskeletally, I can't say that word right now. Um, like as well. And I was just talking about this because we work with some of the dancers at the Boston Ballet, and one of them just got feedback from the director of like how good she looked, and we were talking about how
mm,
that was so directly related to her feeling like she's doing this for her, and this is because she's feeling more confident, and how that's showing up on stage, and that means she's
mm,
losing, she's not getting as injured. Or another dancer who just had an incident where she was all of a sudden more anxious to go have these performances, and we talked about how that anxiety is so correlated to higher risk of injury and how that rigidity
hmm.
and tenseness. So I think there's all these ways that it shows up, like maybe a little bit subtly, but also a lot more obviously. And
Hmm.
dancers are so in tune with themselves that it's a little bit more obvious in those situations
Yeah.
to have conversations. But um, I'm talking with people all the time, and like, really, you need to go figure this out physically in order for us to even know what's mental and what's physical. Like, they're so intertwined that I mean, I'm constantly having those conversations.
Yeah.
That's why I
And
think
did people,
collaboration is important.
Yeah.
Sorry about that, Tim.
no, sorry. I was just going to say, do you also have people that report um, relief or resolution of musculoskeletal, ache or pain or tightness or stiffness after doing therapy with you guys? Or are they saying, I also had this pain in my back or in my shoulders, and I just feel like it's released, and I haven't even done anything to directly manage it?
Mhm.
I think that that will definitely happen for sure. I wouldn't say it's like necessarily that like A to B with it. But I think that over time, especially for people who tend to kind of be those perfectionists in the rumination of, oh, this hurts. I once had an injury here. This is going to turn into that injury. And you start to fixate
Mm-hmm.
on pain. And then when you kind of start to work with them to figure out like, this is a fixation, what would it be like to kind of like notice the pain and be able to notice and move on? And then the pain all
Mm-hmm.
of a sudden kind of becomes less and less and less. And if it doesn't, then we really need to like reach out to you and be like, you need to go to the chiropractor and figure out what's going on physically. But
Yeah.
definitely a component where, especially when there's a trauma related to an injury or something like that, where it feels like if you can work on the mental side, it really releases the physical side.
Mhm. And then there's also like the psychological pain, right? So somatic pain, when somatic pain shows up. And I've started working recently with a couple of folks on like how we use that pain in the body as a way of further understanding psychological distress. So
Mm.
for example, like, I'm working with a runner we're actually using running as a modality of healing from sexual trauma, history of sexual traumas. And she'll have a lot of somatic symptoms even in the session, right? So
Mm-hmm.
oftentimes, and we know she's been checked out, so we know these aren't physical issues, structural issues, but they present that way. They feel that
Mm-hmm.
intense, right? So when she's having those in the session, we can actually use the somatic responses in a way to further understand something that we are not conscious of, right? So oftentimes we will
Yeah.
kind of I'll coach them to like, close their eyes, making sure they feel safe, right? But let's close our eyes. Let's go into where that pain is in our body and let's begin
Mm-hmm.
to, right? What is this pain in my chest trying to say to me right now? Right. And then, through the process of time or what have you, essentially what you're doing is you're kind of creating the pain as an entity and you begin to
Mm-hmm.
dialogue, right? And you begin to dialogue with
Yeah.
the entity and you begin to learn, wow, what are you trying to tell me? Right. And I've
Mm-hmm.
seen in those processes people crack, right? And they'll begin to cry and they realize that pain is actually a deep rooted fear, right? And all of a sudden we now are talking about something ancient, right? Deeply
Mm-hmm.
psychological. That fear has been
Yeah.
present ever since I was 3 years old when I experienced this trauma, et cetera, et cetera.
Mm-hmm.
So we begin to develop a relationship to the pain in a way that it creates the healing process.
Mm-hmm. Yeah, I love that, using pain as a window and creating insight to what might be lying deeper. I mean, I think that I tell people all the time, we talk about even the definition of pain from the International Association for the Study of Pain, which is one of the most respected organizations that study pain. The definition of pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage, which is, there's a lot to unpack, but the fact that it's sensory and emotional, every pain experience is a sensory and emotional experience, and it's associated with actual or potential tissue damage. All of which I think speak to the fear that you're describing. And there are lots of different forms of fear and threat where we could notice something physically in our body, but it might not be associated with an actual tissue damage. So it's, I think, important to unpack that for patients, because it almost, especially for chronic issues, it almost gives them permission to try different avenues to manage their pain too. Because so
Mhm.
often we'll see people that have been to like 7 different chiropractors, and they've done PT a couple times, and they get massage, and they go to acupuncture, and they're always looking for this elusive like issue in the tissue and ignoring the mental, psychological, emotional side of things. And that, I think, even just telling people that, this, all pain is a sensory, especially chronic pain, persistent pain, is a sensory and emotional experience, and that there could be something here for you.
I like that. Yeah. I've never heard that definition. That's real good. Yeah.
Yeah. Yeah, it's a mouthful, but I think there's a lot in there. Yeah.
Yes. It's accurate. It plays on all the parts. Yeah. No, I like that a lot.
Right. And you touched on this a little bit, but in situations where an athlete might be injured and they've gone through the rehab, they're physically cleared for participation in sport, but the mental emotional barriers sort of outpace the physical healing. Like there's persistent mental emotional barriers that are preventing them from taking the next steps, even though they're physically healed. Like, do you ever see that?
Oh, yeah. Yeah. A fair amount.
Yeah.
A fair. Um, it's interesting. So I do think that at that juncture of your career, you have a choice, right? Like, do I continue to play or do I not? And
Hmm.
both of those decisions are hard. And at that point, it becomes like choose your hard, right? Like
Hmm.
either is going to be difficult.
Right.
Um, so I've seen people that have let that barrier end their career, and I've seen people work through that barrier and their career evolves. Sometimes it's them finding themselves in a place that they're not performing the way that they were pre-injury. And so what does that
Hmm.
mean? Sometimes they're back on par, sometimes they exceed. And what does all that mean? So yeah,
Yeah.
we see that come through. And I think a lot of the time, like when someone's in the midst of that, the therapy really is, hey, like let's process this and figure out like
Hmm.
what is the best choice for you at this time. And a lot of it is really helping people kind of divorce their minds from expectations of the
Mm.
coach, of parents, of friends. Like I have one client right now who's a runner at BC who is experiencing coming back from a series of injuries. And so she's just been cleared and she's trying really hard, but that mental barrier is like, oh, I'm running differently on this leg because it hurts. And then
Hmm.
that make her more susceptible to injury if she's running scared. But
Right.
anyway, all of that's to say that her decisions right now are very much being dictated by the coach because she's there on scholarship. And so
Mm.
that's really hard. So
Yeah.
there's implications to some of these folks around making the decision to stay in sport or to not. And so I think the therapy really becomes about, hey, let's look at this from all the perspectives, and help you make the best decision for you.
And I think
It
part of
does.
that too is giving space for the idea that they might retire or they might choose to end their career. And like, I feel like that can be so taboo when you're
Hmm.
existing in a highly competitive world of you don't necessarily want to bring that up to your teammates. You can't really talk to your coach about that. Your parents might have
Right.
their own agenda. Like everyone kind of has their own thoughts and feelings about that. So having a place to be like, what would that look like? That's totally an option if you want that to be an option. Let's play it out. Like pros,
Right.
cons, really talk through that and give it space because it's a valid thing. And like talking about that and talking about the physical injury, but also the mental injury that can come along with that and how it can be so
Hmm.
traumatic to get injured and how much there is to that. I was literally just talking to someone about a trauma anniversary of a mental injury. Like
Yeah,
every time it hits this time of year, she has a panic attack. And it's just because that's when she had that mental injury happen and her body's like primed for it. So I think kind of talking about all of those things when someone's in that kind of a situation is a little bit revolutionary for people who just like
Hmm.
don't have space for that anywhere
yeah,
else.
Right.
It's fun to have those conversations.
yeah,
Right. You're almost giving them permission to think about it, which other
Yeah.
everybody else in their environment probably doesn't.
And
It's
completely non-judgmentally. Like
totally.
right.
every side
Send
is like,
it. Yeah,
yeah.
exactly.
Yeah.
Exactly.
By the way, I find that the concept of trauma anniversary so interesting. It was something that I had talked to patients about, for years, and then I think it was in probably The Body Keeps the Score, Bessel van der Kolk, the book that everybody's read, in this space. It talks about it even more. I just think it's fascinating that it was even a thing because it was something that I noticed before I knew it was a thing.
Yeah.
It's fascinating. Yeah. So Allison, when you came to the roundtable that we had, you spoke about this idea of athletes kind of tying, especially female athletes, tying their identity to their sport, right? And then when their ability to participate in the sport is impacted, maybe because they're injured or they're dealing with pain or they're getting older, retiring, any one of those things, they become a parent, a mother, um, that we see issues because their identity is so tied to them being an athlete. And if they can't do that, that's problematic. So do you how do you guys as therapists help people sort of separate their self-worth from their identity as an athlete? And I realize it's a big question, but
Yeah. Woo!
I feel like that's
sorry.
like the question.
I know, right?
Yeah.
Give you a really annoying answer, which is called it's case by case.
Yeah.
And I really do think I do think it's case by case. And I'll start, but Hannah obviously chime in because it really is the question. And I say it's case by case because the way that I approach it is tell me what this means for you at this time.
Hmm.
And I try to approach it with no preconceived notions of what this could mean for them or what how other athletes have dealt with it. And sometimes they'll say, well, what do other athletes do? Like, how do I, give me some examples. And sure, I will after though, right?
Mm,
Help me understand what this means for you at this time. And I think one of the most important things is getting in touch with an understanding. And people may know this and they may not know this. And so you'll have a different starting point. But really getting in touch with the idea of what are your value systems and what are your priority systems. And essentially, as you begin to kind of understand the tree or the roots of which those things are, you begin to learn more about what their purpose is.
mm,
And that's the big one is purpose, right? Because especially as a professional athlete, like their purpose was I'm working with a retired football player right now, right? And in his purpose, the only thing was to like he'll talk about it. He's like, my only purpose was to hit people and do it really well and
mm,
then make money. Like that was
yeah.
it. Right. And so when that stops, it's not just, the who am I question, it's also like, what is my purpose? And so I think understanding value systems and priorities, what emerges from that is purpose. And that's how we help them, I think, begin to differentiate. Oh, this was my purpose as an athlete. What is my purpose now as a human? And what kinds of choices and decisions can I make in my life to help bring that forth? And that's
Hmm.
process. That's process that takes time and it's really, really hard,
Yeah.
especially working in a unit of like a family structure, who understood you to be this way or friendship
Hmm.
structure to be this way. You're unbraiding it, not just for you, but the people around you too. And that's really hard.
Yeah, I would say purpose. I really focus more on the values, I think. Like I'm thinking about actually a dancer too who I'm talking with right now who just like loves it. Like she's so passionate about it, but we've been talking about how having it be her everything has actually been incredibly detrimental to her and how just like something as simple as creating a morning routine for herself has changed her life and like made it so that there's a moment where she's a human and not a dancer. And like
Mm,
starting kind of
hmm,
separate out like this is part of you and it's an incredibly important part of you and you love it, but it's not you. And that all started from her being on vacation with her family and realizing that her family was bragging about what she did. And she was like, I didn't really want to be a dancer in that moment. That was so weird for
mm,
me. And it's like, oh, let's like break that down. Let's talk
Yeah.
about it.
Yeah.
So I think when I work with people, again, coming from more of that eating disorder lens, it's like, how do you start to recover from the eating disorder? You realize that your values don't align with what the eating disorder's values are. And I take that lens into working with the athletes as well as like, this is incredibly important. Again, that dichotomy, how do we hold all of the truths? Like, this is
hmm,
so incredibly important, but is your value for this to be your everything? And taking that approach, I think there are ways where I don't want to say easier because nothing is easier about being a professional athlete, but it's like
hmm,
then we can frame it as this is your job. Who do you want to be outside of your job? Whereas someone who like this has always just been the thing that they're passionate about and they never let go of it, the lines it are a little bit more blurred. So yeah, case by case when you're talking about it. But I love talking values when we're figuring out like, sport is really important, but it's not everything. Nor should it
Hmm.
be. And nor should like like if it is everything, you probably won't be as fulfilled and you won't be as good at your sport. So let's look at this from every
Right.
angle.
Right. Yeah, again, I can relate to so much of that as a former athlete, thinking that it was something that I was going to do professionally. And you start to see just how many of your relationships in your life were sort of based on this idea, or this idea that you had for yourself and this idea that other people had for you, that you're an athlete, you're an athlete. It's every time your parents would, introduce you to someone, or it's the first thing that, is talked about at parties, or the first question that people ask you about. And then to not have that, you're almost lost. You don't know what good am I in the world if I'm not this thing? Like I need something else to be good at. So there's almost like a grieving process that takes place. And it sounds like you guys do a really good job of reframing, helping people zoom out and find something else to focus their energy and efforts on that's bigger and more than just a sport.
And I'm glad you mentioned
Yeah.
grief because I honestly we should have mentioned grief.
Yes, yeah,
Like
yeah.
it is a grief and like approaching it as that is really important when working with people. I mean, I will vividly forever remember one of my first thoughts after I quit my sport because of injury and whatever, everything going on. One of my first thoughts was, what's my fun fact? Because I was a
Mm,
freshman in college and I was like, I kept going to all of these introductory things.
Orientation. Yeah, yeah.
And I was like, I don't know. And that was terrifying. And so I think like
yeah.
talking to people about that grieving process is huge.
And exactly right. It's process too, right? So it's grief and it's mourning, right? Like we actually have to engage with actively mourning the loss in order to move through it. And I think that's like you see that show up. Like you can tell the people that have mourned the loss of their sport in really healthy ways, right? And people who haven't even touched it at all. It'll show up. It'll show up haphazardly in their life whether they like it or not. Like there's a process I think that really needs to um that folks need to engage with, and I think it's a great therapy is a great setting to be able to do that. It's a safe setting to be able to do it, and it's a thorough setting. um so
Yeah, that makes a lot of sense. Um, I want to shift gears a little bit to away from sport and just kind of exercise more broadly. I started teaching a class recently. It's called Exercise for Special Populations, and it's a college course, and every week, we have a different special population that we talk about using exercise as an intervention for. So whether it's cancer or cardiovascular disease or chronic pain or older adults or youth, pregnancy, all sorts of things. It's great. The take home is that exercise is good for everybody for all these different conditions. And in basically every slide deck that we have, it was pre-prepared for me. There's always like a little footnote at the bottom, like, oh, this also improves anxiety or improves stress, in this population. Typically, the focus is on more of the physical adaptations, like it's going to improve, cardiovascular efficiency or, et cetera, et cetera. But there's always this little footnote. I think it's great that that's being mentioned, but also I feel like there's more there to unpack. And then I think about people that we work with that are in that category where they're being held back by injury or pain and they don't have access to exercise as their form of stress relief, right? Like we have so many people that need to exercise. And if
yes,
they can't, they're in a bad place mentally.
yes.
So I'm sure you guys see a lot of people like that too. What I'm curious about is are the not those people, but almost the people on the other side where they don't necessarily see the benefit, or maybe they don't have as much experience. They didn't grow up being an athlete or exercising in general. And you think that engaging in a movement or exercise routine would be really helpful for them. How do you have those conversations? Because I think the other side is a little easier where people already sort of get it, but I have a hard time motivating people or talking about, those mental health benefits for people that don't that only see exercise as a form of as a way to improve themselves physically.
Hmm. Hmm. No, it's a
That
great
makes sense.
question.
Yeah.
You want to
Yeah.
do go ahead.
Sure. Again, I'm gonna probably use Glenn. I think for me, like I can think of people who've been in recovery and exercise was only a part of their eating disorder. And so then we have to
Mm,
kind of frame it a little bit. And so I actually don't use the word exercise, I use the word movement in
Yeah.
cases.
yeah,
And we talk about joyful movement, and that movement means a lot of different things. Because exercise kind of sounds like on the elliptical and going and doing the pulley machines at the gym, whereas like
yeah,
movement could be rollerblading in the park. Like, who the hell knows what that means to you? So I think
yeah.
broadening, using language to broaden the definition of what that means and say, like, would it help you to be outside? What do you want to do outside? Oh, skateboarding always sounded fun. Like, why don't you try that? And just kind of
Hmm.
taking from a more creative lens versus you need to kind of fit into this mold of this thing that was once very detrimental for you. Or I'll see sometimes like parents really pushed exercise. I've seen that for people, and then all of a sudden they need to reclaim it for themselves. Like, there's so many different things, so when you call it movement, it becomes a different category, and it's so much easier to talk about with people.
No, I
Yeah.
love that. And I think like, and this is where again, I think case by case becomes really important because I think that's a really great way to take it. And also there are still skeptics, right? And so for the skeptics, great because we have like brain scans and studies, right, that indicate that when we move our bodies, hormones in our brains are released that actually show, right, improvement in mood. So I think creating the space, as you said, Hannah, to kind of use language in a way that can expand what that means. And also you can take a psycho-ed approach where it's kind of like,
Mm,
hey, look at all the data that says this feeling and this feeling and this feeling. And I think like once you can encourage them to start moving, helping them track mood with movement, right? So
yeah.
they will begin to feel better, right? So where were you before you moved on a scale from 1 to 10, 10 being amazing, 1 being 0, like horrible, no energy, whatever.
Hmm.
And and then engage with the movement and then assess afterwards. Has mood improved? And I think, when you can kind of, for the skeptics, because
Hmm.
when you can kind of bring science into it and, make it evidence-based and like all these things, people get onto that.
Yeah.
So
And and I would say, like, again, sorry, eating disorder, devil's advocate sometimes here, but like I think also us not having any opinions about it to a certain extent.
Mm,
Like, here's all the information, do with it what you will. Like, and I think when you give them that space of like, I'm not going to judge you if you don't do this. Like, I want you to feel better, but if that doesn't appeal
hmm.
to you, that's also totally okay. That can sometimes free it up for them to actually want to do it for themselves, because
yeah.
otherwise you might be reinforcing a dynamic from whatever coach, parent, whatever, doctor, who's saying you need to do this. And when you join that, they're not going to hear any of the data because they just
Hmm.
hear all those other people who are telling them that they're doing something wrong. So I really try to come from this very like, take the information if you want it, but also like if that doesn't feel good right now, that's okay. But also right now, like maybe we check back in 6 months and see if that's something that feels better then.
Hmm. Yeah, I love that. One of my favorite books in this department is it's called The Joy of Movement by Kelly McGonigal. Have you guys read that?
No.
It's awesome. She's a health psychologist out of Stanford, and in one of the chapters, it's kind of like an exercise or movement is medicine type framing where she goes into the benefits, of exercise, kind of like I do in this course I'm describing. And when you look at the research, if you were to consider exercise or movement as medicine, and you're comparing, outcomes for different, clinical populations, the drug that exercise mimics most closely the benefits of are antidepressants, is or at least that's what she has in her book. So I always found that really interesting.
Yeah.
But yeah, it's a great book. I think you guys would love it.
No, that
Yeah,
sounds great. I'll
Um,
definitely
uh,
check it out.
yeah.
I want to be respectful of everyone's time. I know we're already over. I want to finish. Maybe if we could talk for a minute about the fact that, like, even starting this conversation, we were saying things like people come to me for physical problems, they come to you for mental, emotional, psychological problems. It feels like we've made some progress, like as a healthcare system and as a society from an awareness perspective, like, hey, these things are both important, right? Like you need to work on your physical health and your mental health. But it also still feels sort of fragmented in that way. Like, and sometimes some of the patients that I work with, they're going to see, me, they're going to see a massage therapist, they're seeing a psychologist, they're seeing, they have an acupuncturist, and it just becomes very fragmented. And I wonder if you guys have thought about this at all, and if there are groups out there that are doing this really well, where they're sort of integrating things in a more seamless way. And it's not that you have to go to like seven different places to be seen as, seven parts of a whole person. Um, do you know what I mean?
Oh yeah. Yeah. No.
Yeah.
I can't, I don't know, Hannah, I can't think of any place that's doing that off the top of my head. I think for people that truly understand the holistic approach of this work, that's like a dream I think we kind of all have. And it's a big question mark for me as to why that isn't into being, right? Like why?
Yeah.
I will say that our most effective referrals, right, when somebody refers someone to us and then that client sticks, is typically through another practitioner, like yourself. It tends to be from the physical practitioner of some kind, and when that person knows that you're in relationship with one another, meaning like Tim, you work with Allison, and we're going,
Hmm.
this is my colleague, this is who I know, that those are the most effective referrals, rather than, someone being like, oh, I know this, this therapist, go check her out or whatever. Or, oh,
Hmm.
oh, this person, we have a relationship with this person, this is my colleague, we work together. Those ones tend to be the most successful. So there's something I think really powerful in the transparency of the collaboration, that's super important. But I would love to see like a center where all different disciplines like came together and worked at the same time. So it'd be like, cool, like you come for therapy and then you go down and you get your chiropractic work. Like you could come in a day, right? And
Mm.
like have a day. Like that would be so amazing. But yeah, I don't know of anything like
Yeah. I don't
exists.
know of anything like that either. And like insurance is so not set up for that like
That's
Yeah.
a huge barrier.
um,
Yes, that's a
is a
huge
huge
barrier.
barrier, but it's definitely a pipe dream. Allison and I have talked about this of like we'd love to be able to at some point kind of like be so holistic that that happens. I think what I see too is that we're so deeply ingrained in our medical system that people will come in and be like, Hannah is my therapist and Tim is my chiropractor, and I'm going to talk to like, and then this is my dietitian, and I talk to my dietitian about food, and I talk to Hannah about my mood. And so some of it too is like a mix of psychoeducation and referral in a session. So
Hmm.
like, I want to talk about all of you. I want to make sure that you feel seen, but I also want to note when we're kind of out of my depth and give you my nugget.
Hmm.
Like, I think Tim would be really good to keep talking about this, but like also talk to him about whatever, and then he'll talk, like, so I think that
Yeah.
collaboration, the closest we can come right now. But I would love to see it be even more integrated than that. But I do think there's a little bit of unlearning for clients and patients too, because they've existed in this
Yeah.
system and it's been fragmented.
It does seem like a system-wide issue, and it's when you bring insurance into the mix, it becomes especially hard, like you said.
Yeah.
And I
Yeah.
agree. Like, I think in our world, there's been a push for maybe a decade or so to be offering more psychologically informed care. Like, we are trying to use some of these bigger models, like the biopsychosocial model, and to have appreciation for, the physical, mental, social, seeing this person as a whole. But it's also a lot for any one person to take on, and you get into scope of practice issues where like I shouldn't be talking to people beyond a certain level, just like you're saying, Hannah, when we're outside of my scope. So I think what you guys are saying about the trust and collaboration is huge, and I've seen the same thing. We've seen the same thing in our practice, where if it's a trusted referral, if somebody's already whether it was, through personal training or a medical doctor, if somebody has developed trust with a patient and then they refer that person to us, it's almost like that trust carries over and we can
Yeah.
already start at a deeper level. And then the fact that people know that if we refer to someone or vice versa, that we are going to reach out to that other professional and make sure that everyone is on the same page. Patients seem to appreciate that a lot too, and that seems to go a long way.
Yeah.
So,
Absolutely. Absolutely agree. I
And
like that.
I
yeah.
think to bring it full circle, that's the perk of all of us being athletes is that we're inherently team oriented. So like
Mm,
Yeah.
that makes such a huge difference as a provider too. If I love to be a part of a team, like, and that's one of the first things that I do is that collateral contact. And so working with athletes who are used to a team and then also having that team mentality as a provider, I think is so helpful.
yeah,
Yeah.
totally agree. Yeah. Well, all right, guys. Well, can you tell me where people can find you? Like website, where your office is located? Do you do telehealth? What does all that look like?
Yeah, so we have a website. It's estherapygroup.com. So E Earhart is Allison's last name, Singer, my last name, therapygroup.com. And then there's like an intake form on there that people can fill out. We have an in-person office in Brookline, and then we also have an in-person office in Woburn, and then offer telehealth. And we take Blue Cross Blue Shield and Aetna.
And we have an
Perfect.
Instagram
And we have
that
an Instagram.
run by millennials, so it's not awesome, but that's at ES Therapy. Is it ES? I don't even know. I think it's ES
Happiness therapy room. Yeah.
I think
So
that's
check
what
it
it
out.
is.
Yeah.
Yeah.
There's a link on our website if you get
Yep.
lost.
Yep.
Okay, perfect. And I'll link to it wherever we end up putting this. But
Perfect.
okay, awesome. Well, I'd love to chat more at some point, guys. I have a ton more
Yeah.
questions, but I learned a lot from this and I appreciate you taking the time. So thanks again,
Of
and
course. Thank
I
you.
hope to talk again soon.
All right. Sounds good. Thanks,
It was
Tim.
fun.
All
Thanks,
right,
Tim.
take care. Bye.
Bye.
Bye.